Hello everyone, thank you for joining us for our webinar today. We're going to start in just a minute. Just wanted to get the screen up so everyone knows you're in the right place, and we will speak more in a moment. Okay, I think we'll go ahead and get started, though I still see our participant number climbing up. I know people are still connecting. We want to get started today so we can make the most of the time that we have. Thank you for joining our Strengthening Families monthly webinar. And today, this month, we're focusing on continuous quality improvement and how we can use that in our practice, and especially as it relates to family engagement and protective factors. Having a little bit of a slide challenge. There we go. So today I will share some updates from the Center for the Study of Social Policy, and then we're going to jump right into our main topic and hear from Dr. Prashant Rajvedaya from the Mosaic Network. So I will share some updates from CSSP and just let you all know, in case any of you are new, these are our monthly webinars that we do related to the Strengthening Families Protective Factors Framework. It's an open invitation. Anyone is welcome to join us if you're interested in or using the protective factors or coordinating Strengthening Families efforts. My organization, CSSP, which is the home of Strengthening Families, jointly convenes these webinars with the National Alliance of Children's Trust and Prevention Funds, who are one of our best and strongest partners in getting the word out about the Protective Factors Framework. And we jointly select topics and bring in guest speakers. And we always welcome volunteers from the National Network to tell us if there's a topic you'd like to share something about, if there's interesting work you're doing that you think would make a good webinar topic, or if there's something you have a big question about that you'd like us to address in a webinar, let me know that. We always post the recordings and slides and other handouts from the webinars at this Google site that's maintained by the Alliance. You will also get, everyone who's registered for the webinar will also receive an email follow-up that has a link to the recording. But if you want the slides, go tomorrow or maybe Monday to this Google site, and that link will also be in the follow-up email. We also always put a summary in our newsletters that go out every other month so that you can find out what webinar is coming up and link to the recording of the old one if you missed it. Not the old one, the previous one if you missed it. So coming up, we do this the second Thursday of each month, so the dates are there so you can make sure you have them on your calendar, and then we'll announce the topics in newsletters coming up so that you know if it's one you want to participate in, if it's a topic of interest. I also always encourage you, if the topic is of interest to you and you think you have a partner who would like to hear more about it, or someone who doesn't usually connect into Strengthening Families, but this would be particularly relevant, feel free to forward the invitation and include them in the webinar. So we've got some really good topics coming up for these fall dates, but haven't quite pinned down which one is happening when. So those will be coming out as they come closer. And again, feel free to contact me if you've got a topic you think we should cover. So the first thing that I want to spend a little bit of time on today before we get into our main topic is the Together for Families conference. This conference is happening for the first time ever in Cleveland in October. And it is co-hosted by CSSP and the National Family Support Network, along with the Greater Cleveland Family Strengthening Network, who are literal hosts there in their city. And we are very excited that we've got many national partners engaged, including the National Alliance of Children's Trust Funds, Be Strong Families, Child Care Aware, the Help Me Grow National Center, Parents Anonymous, Circle of Parents, and I feel like I'm probably forgetting someone. I meant to put all their logos on a slide, and I did not. Mosaic Network, who's participating today, is also a sponsor of the conference. So is Butterfly Trainings that Transform. So we have a lot of our key and long-term Strengthening Families partners are going to be part of this conference, and I really hope that a lot of you will be able to come. I've got a couple people on the line who are on the planning committee who could share a little bit about what they're excited about. And I'm checking right now to see, make sure I can unmute. Oh, I'm not seeing the name I was looking for. If anyone is on the line who would like to share what you're looking forward to at the conference, please raise your hand or send a message and we'll unmute you so that you can speak. It's looking like the volunteers I had are not on the line yet. So I'll share a little bit more about what I'm excited about. We've got 3 different strands of topics which are all interrelated, but there will be breakout sessions that relate to strengthening families and implementation of the protective factors framework. Then there will be some that relate to the standards of quality for family support and strengthening programs. And then there will be some that relate to the field of family support more generally. And I think any one of us, anyone who's calling into this call would be interested in a lot of the topics that are going to be presented in those breakout sessions. We've also got plenary sessions planned. The first day will focus on resilience, and Pat Stanislawski will be speaking. And I know that anyone who's been to a training of trainers for the Alliances, bringing the protective factors framework to life in your work, if you've been trained by Pat, you know how fantastic it is to hear her speak. So we're really excited that she's going to be doing the opening plenary. And then on the second day, we're going to have a plenary focused on equity and what we can each do in our various roles to build equity and how that relates to protective factors. So I'm very excited for that and definitely hope that we will see many of you there. Let me just do another quick check to see if we have a member of the planning committee who's able to speak up. Raise your hand if you can. Oh, I've got Rajel. Okay, let me, Rajel, I'm coming to unmute you. Here we go. Okay, Rajel is on the line from Pennsylvania. Can you try speaking?
Sure. Can you hear me?
Yes, we can. Thank you.
All right. Wonderful. Well, Kaylin, I think you did a really wonderful job of setting up the conference, and we are very excited about it. And I do hope that many of you on the line do have that if you have a chance to attend, that you do. So I am excited for the pre-conference sessions that there are some things related to the standards of quality from the National Family Support Network. There's also, oh, look, right there they are. Kaylin just put them up. So these pre-conference sessions look fabulous as well. So 2 different sessions from the National Family Support Network, and then one that looks really great from Be Strong Families. So I am excited about those as well. And I think this is going to be a great opportunity to network. I have been missing those larger strengthening family summits. I only got to go to one of them, so I'm very excited to come together with all of you and talk about strengthening families in October.
Thank you so much, Rajel. And perfect segue to talking about the pre-conference session. So the conference itself is October 16th and 17th, which is a Tuesday and Wednesday. But on the Monday, there are some opportunities for full day or half day trainings. And as Rajel mentioned, there are 2 that are being offered by the National Family Support Network. One about the standards of quality for family strengthening and support programs, which is actually full. So you can get on the waiting list for that if you want to. But if you've got that day that you can do some training, there are 2 other great options. Building and sustaining effective parent advisory councils is also being offered by the National Family Support Network. And then I've got Nadia Washington on the line from Be Strong Families to talk about the day that they're offering on reducing stress and enhancing vitality with strengthening families' protective factors. So Nadia, do you want to tell us a little bit about that? Nadia, you may have muted yourself. It says you are self-muted, so you're going to have to unmute yourself. Oh, shoot. We could hear Nadia before the webinar started, and now we're not getting her voice. So maybe we can...
Hello?
Oh, there you are. Perfect. Right before I had to
Okay,
go
it wouldn't let me unmute. I'm sorry.
There you go. You're good.
So I just want to just encourage everyone that we are doing reduction or reducing toxic stress, which is in the Vitality Cafe, which has been one of our two major enhancing the vitality. I'm sorry, which has been two of our major sources of uh, opportunities for families and for staff in the community to understand how to apply those different pieces in your life. You know, we all kind of suffer from things that are related to toxic stress, work-life, balancing home and work dynamics, uh, just everyday things that are happening within our bodies and outside of us, how our work life is affected by just everything that is going on with trying to keep up with the day-to-day life, and how vitality in that position can help us grasp and grow to a significant piece that we can become peace and try to look at what we've been doing, what can we actually add to our lives, and moving us toward having our best self. So with the vitality piece, it's looking at the domains, social, economic, environmental, physical, all of those different domains that are different pieces of our life and how those pieces interact with the other pieces. So how financial and social go together and how that may include some type of stressful situation. And so when we go back to the strengthening of families and protective factors, we're also looking at those protective factors that overlap with the different domains. So resiliency, parental resilience, social and emotional qualities within our children, knowledge of child and parent and child development. So we're just making sure that people are aware that this is a good session, and we've kind of combined a couple of different things. Our strongest combinations of services that we provided over the past couple of years, and where our families and communities have needed most. We're kind of combining those things for our particular workshop, and we're looking forward to inviting those people to come out and say, hey, you know, I want to know how vitality affects me within in understanding the protective factors. If you've ever been to a parent cafe, you've experienced that. We're kind of doing all those things in one. And so this whole workshop is a great opportunity to get a touch of three different parts of our strongest community outreach services in one day, in one session. And we're inviting you guys to join us. This is one of those particular things that if you wouldn't want to miss it. We actually just did a Vitality Cafe in Missouri, and they enjoyed it, and they were coming back for more. So we want to make sure that you guys are coming out and sign up for our workshop. It's an opportunity like no other, and do not miss this opportunity to be a part of this process in our journey to vitality. And I thank you guys for giving me this time.
Thank you so much, Nadia. And I want to make clear, if you look in the sidebar of the webinar, Trish posted the link to the conference information, and that has everything you need to know to get registered for the conference itself, as well as for any of these pre-conference sessions. Though, as I said, the Standards of Quality certification is full, but you can get on the waiting list if you are still holding out hope for that one. Actually, if there's enough people on the waiting list, we could possibly add a second section, but we know people need to make travel arrangements, so it's kind of hard to do that at the last minute. But I did want to make sure it was clear that the Reducing Stress and Enhancing Vitality training, there's a morning session and an afternoon session. You can do the full day, or you can select just to do one of the other half of, the Reducing Stress with Protective Factors or the Enhancing Vitality section. So I hope lots of people will take advantage of that opportunity, and we're really grateful for Be Strong Families for working with us on this. And there will also be a strong presence throughout the rest of the conference. The other thing I wanted to mention, the full conference is October 16th, full day on the 16th, and a half day on the 17th. Before the full conference starts, which is, I believe, at 9:30 in the morning on the 16th, there will be hour-long orientation sessions. So if you, for example, are well familiar with Strengthening Families Protective Factors, but you've been curious about the standards of quality, you can go to a 1-hour orientation about that. There will also be a 1-hour orientation about the National Family Support Network, and there will be a 1-hour orientation to Strengthening Families Protective Factors framework for anyone who is coming to the conference but not already really well versed in that. And those of you who are state leads for Strengthening Families will also have a meeting of state leads as a chance to connect with each other and check in on the great work that everybody's doing. So very excited for this opportunity to bring people together, and I hope to see lots of you there. I love that we can connect by webinars and newsletters and emails, but those in-person opportunities are always so much richer, and can't wait to hear all the great work that you guys are doing that you can share at the conference. All right. All of that said, we're going to get to our main topic, and I'm pleased to welcome Prashant Rajvadia, who is a great partner over at Mosaic Network. I'm going to make Prashant the presenter so he can share his slides. And he's going to talk about continuous quality improvement and some of the exciting work that's going on and how you can get involved. So Prashant, are you ready?
I am ready. Hello, everyone.
Hello. We can't see your slides yet.
But I'm almost ready.
Okay.
All right. Give me 1 minute. So I am the presenter. Okay.
If you just
all right. Can you see my slides now?
Yes. There we go.
All right. Okay, great. Hello, everybody. My name is Prashant Rajvadia, and I am co-founder of Mosaic Network, Inc. But here I am representing the great partnership, as Kaylin said, with CSSP and some really great organizations that we'll be introducing today. What we wanted to really talk about today in this webinar is we wanted to introduce an approach that we have been fine-tuning in recent years that really enables policy leaders to promote practice of continuous quality improvement among all stakeholders. We're calling it CQI Hub, and with the main goal to sort of promote cross-strategy and cross-sector improvement in program quality and starting with parent engagement. So it's a mouthful. The bottom line is we all have been struggling, wanting, needing to do continuous quality improvement in our programs before QRIS came, after QRIS came, and all around it. There have been challenges, and we believe we are on to some really interesting approach that can help us really and easily implement continuous quality improvement in our program. So let's get right to it. The agenda for today's webinar is I'll quickly talk about the background of who we are and what our partnership and collaboration looks like. Then we will get to evolution of this continuous quality improvement hub that we will be launching today and introducing today. We'll get into the basics of this new approach, the theory behind it. Then we will quickly look at some of the pilot projects that we've been running in the last couple of years, look at some of the results. And we are excited and hope that a lot of you will be able to join this initiative, so we'll discuss some next steps related to that. All right, so as I said, I'm Prashant Rajvadia. I'm from an organization called Mosaic Network. We've been around for 20 years. We spun out of UCS, University of California, Santa Barbara, about 18 years ago, actually. And we have had privilege to work in a lot of really interesting initiatives in last 2 decades in 42 states, multiple countries, all around how do you use data, evaluation, and research to help inform decision-making in day-to-day practice. Today is not about Mosaic, so I am here representing a phenomenal partnership that has come together in recent years. Of course, starting with our great partners at CSSP and University of California, Santa Barbara, who have been our research, like deep, high-end research partners. We recently also Western Michigan University has come on board. They have some amazing thinkers in terms of evaluation and data analytics. And as I mentioned, I'll be talking to you about some of the results of the pilot projects we've been doing And so specifically, we'll be talking about how we've been applying this approach in Region 2 in California. This is a 9-county consortium in Northern California. We'll be talking about some of the work that we have been doing in statewide evaluation around quality in Louisiana. And then we will also be to cover statewide work, and then we will also be talking about one of the work, some of this demonstration project we have been doing in LA 211 and their grantee, the Harbor Region Center. And of course, the theme that ties everything together is the collaboration that we started with CSSP almost a decade ago around strengthening families. So one common theme among all of these partners is, we all started with the shared vision that parents are their children's first and most important teachers. And families will be stronger and children better off as a result of increased parent engagement, improved programmatic efficacy, a collaborative approach to continuous quality improvement. So you'll keep hearing this theme over and over again, and we really are hoping that by the end of this webinar, you will see a light at the end of the tunnel that yes, it is possible to implement CQI, to move our focus away from compliance, and reuse most of the investments that we have already made to sort of on the front lines at the local, county, regional, and state level, really promote and start practicing the culture of CQI, continuous quality improvement. And that leads us to the evolution of CQI Hub. As I told you, we have been working on this for a better half of the decade now with CSSP and great partners. And it started all 10 years ago ish with really trying to apply online data and reporting system to integrate protective factors in the QRIS and community. So the evolution that I will talk about leading to CQI Hub, I'm sure most of you who are on the call have either heard about it in last 1.5 years through our presentations through on these webinars, as well as we hope that you have benefited from this portal that we have had running and we've been updating, maintaining for the last 10 years in partnership with CSSP. So we started this 10 years ago, and that's where really this vision started. And we got to it because as QRIS was gaining ground and really getting into all our consciousness, family partnerships are included as QRIS indicators in 90% of the center-based and home-based ECE programs. So we thought, great, we have this portal, every program across the country, anywhere, can register in it for free. And through use of these online tools, they will be able to not just do their self-assessment surveys, but be able to collect feedback on the ground from the parents, from the staff. And since it's already a part of QRIS, they will be able to right away jump into using parent engagement as a key indicator for quality, continuous quality improvement within the QRIS framework. So we were naive, we did that, and naive I say because the system, thousands of programs did benefit from it. However, when we asked the question, is the family partnerships is it being used as an indicator of quality? Is it being used for quality improvement? We started to get all sorts of interesting insights from the field, right? So in this section, I'll talk about the evolution of various, how we have really, what you're going to see today is not just on our own, not just because of the partners that you saw on the first slide, but truly it has been based on inputs and feedback and the pain points and the successes that we have seen in the last 10 years from all these thousands of programs and initiatives that they are part of. So we started a listening and learning tool very early on, actually. So as I said, by 2013, 2014, thousands of programs were already using that evaluation portal. So we did 2 national studies. One was based on the national data set of the older version of program self-assessment. And then we are very heavily involved in QRIS. So we also did this state national survey on how is technology being used to collect data and really apply this data back for continuous quality improvement. In addition to that, we also, around 2014, 2015, we started this almost like a listening tour. A lot of users, as I said, a lot of programs were using this portal. They were taking advantage of that. So we reached out to them and we found out from them how is it going, what are the challenges, how are they using the information and the data that's coming out of this portal. And the very first set of learning that we got was we need to report on progress for QRIS and rating and improvement reports using strengthening families protective factors data could really help us. So that was the initial feedback that we had gotten, and these were the early, a lot of states were still coming up to the speed with QRIS at that time, and we it just made total sense. We were like, sure. So that led us to launching of the next iteration of Strengthening Families Evaluation Portal, which we launched around 2015. And then when we again continued to hear from the ground, one of the other key things that we heard was basically we want to integrate data with other data systems, so data sharing and results integration and so on and so forth. So we continue to evolve on this, and now coming back to more recent times, we have been talking about the CQI Hub and its evolution in these webinars. We started talking about it last year. So for those of you who remember, we spoke about all the challenges that we had faced, that we were hearing on the ground, through our listening tool and the solutions that we were trying to apply for it. And as we were, and so when we started with a new vigor in 2017, we really started looking towards continuous quality improvement. One of a very interesting themes started to emerge. We were on one hand looking for, all right, how can we best apply technology to help you implement PSAs and use it for continuous quality improvement. PSA, I mean program self-assessment. But very interesting theme that emerged was that how programs and regions were struggling with how do they sustain high fidelity strengthening families implementation across all programs in their community once the trainers have left the room. We are all we really leverage training of the trainer model to implement frameworks such as strengthening families in the field. But we're starting to see that maybe programs were struggling with the basic implementation of the framework. So that made us to really shift our focus then from just creating a great online data and reporting system and adding reports to it to really finding out what does it take on the ground to implement a framework for parent engagement such as strengthening families. And we got some really interesting insights. So some of the key things that we heard were we need expert resources. So we said, all right, CQI Hub will include resource library. Then we heard that we want to learn from each other's success, right? So peer-to-peer resources, including story banks, was one of the common themes that kept emerging. The next thing we heard most from regional state leaders was we want to really engage programs more, because by last year, most of the usage of strengthening families, at least the way we were looking into how data was being collected, was more sort of for compliance purposes. And for those of you who have been following great work from Build Initiative and Debbie Matthias and and her team, there's this really great thought leadership going from Build on how do we shift our attention from compliance to a culture of continuous quality improvement. And we started hearing a lot of that on the ground. That how do you sort of really engage programs and create this culture of continuous quality improvement in multi-site initiatives. And we started hearing actually that we want to continuously improve. And so one of the things that we again started doing was, all right, how about we automate action planning and tracking of the data? And so when we took all of these things, how do we provide resources? How do we engage programs? How do we, help programs and regions engage stakeholders on the front lines, as well as promote this culture of continuous quality improvement? When we looked at that, that really forced us to look at this approach in a newer way, if you will. And that's when a major milestone and a breakthrough happened for us at the Build conference in July, just a few months ago. This is a picture from a learning community that really started to take shape at Build conference. There was 6 states were represented here, all of them big champions of strengthening families, parent engagement, believers in quality, continuous quality improvement. So out of this learning community, as well as based on all the feedback that we have been collecting through our listening tour in the years past, the need really started to emerge for what is needed to promote culture, what are the gaps that are out there to promote this culture of continuous quality improvement. And when you look at the cycle, a lot of us would have seen it in a CQI, continuous quality improvement at the higher level, and in broad strokes level is very straightforward. You plan an initiative, a program, an implementation, you start acting on it, you collect data and study it, and then you start acting on the results that come out of the study. But when you really dig deep, what you find out is basically that there is no, like, how do you study, right? On the front lines, at the regional levels, at the state level, there's so much going on. There are all the reports that we have to submit, all the trainings that we have to do. Like, everybody's really busy. So who has time to really step back, look at the data, get out of the insights out of it, and insights that you can act on, right? Yes, we have data systems, and a lot of states and programs are using it to generate action plans. But then the action plans are the steps that are required in that also need to have some insights behind it. So how do you really get that? So in order to meet this need, a requirement started to emerge that eventually became the continuous quality, the CQI Hub, as we're starting to call it. So the requirement that really emerged was that we need a community hub of data, results, and insights across multiple programs. We need, and it needs to be designed such that we can demonstrate and improve the impact of multi-site initiatives. Resources for implementation, ongoing practice, and evaluation are very important, and more easily we can make them available, more easily we can maintain that high fidelity after the trainers have left the room, as I had quoted early on in my presentation. And then whatever results come out of it, when we look at continuous quality improvement, we have to look at it across the spectrum. We look at the county level, the region level, at the state level. And then we also, of course, have to look at the children and the families and really focus on the outcomes of the end beneficiaries, if you will. And there's so much data out there that we need to integrate data across multiple data sources. So that's sort of the requirement that we started with in Continuous Quality Improvement Hub. And now I'll talk about how we are theorizing in implementing this. So let's look at the basic framework. So the way we have been doing this is, first and foremost, as I said, we are integrating action planning and reports to support continuous quality improvement efforts. This has been experimented, tested, vetted in QRIS setting, in strengthening family setting by us and by several other amazing organizations out there for last several years. But as I had said, even to do action planning, to create great action plans, you need a lot of resources and training to do that. So the framework needs to be able to support easy, accessible resources and training. Then when we look at continuous quality improvement, just by itself, it becomes a very esoteric concept. So we have to make it applicable such that it could be used for advocacy at the bigger level, and it could also be used for policy, informing policy, as well as helping both staff and parents through communication, so that they can really, without having to worry about the bigger theory and continuous quality improvement and evaluation and such, they could right away apply the results into their day-to-day practice. And when you really look at all of these things, the best way to do it is, as we've understood, is really have to focus on cost-effective evaluation and reporting. And for all of us on the call, I'm sure we all are aware of evaluation, and the cost-effective evaluation reporting is the key here, because we can always do very complex, formative evaluation, do complete logic model and so on and so forth. But that traditional model of evaluation takes too long to implement. So if you want to use it for in real time to really have an impact on the outcomes before a child or a family leaves this fiscal year services, we really have to rethink the evaluation itself, if you will. And I'll talk more about it, how sort of we create that cost-effective evaluation approach, and that sort of becomes the key of CQI Hub, and how everybody can easily start implementing CQI in their day-to-day practice. And so that really led to going back to our evaluation research technology background, and by our I mean all these great partners that we have, to sort of starting to creating the concept of CQI Hub. That all right, we need evaluation. Evaluation is based on data. So how about we create a community hub of data, results, and insights that could be run across multiple programs, and let's design it to demonstrate and improve impact of multi-site initiatives. Let's make sure the resources for implementation, ongoing practice, and evaluation are all included in it. And we have done that, and I'll soon briefly introduce some of these pilot projects that I mentioned, and see how we have used this type of hub features, if you will, in those. When we were implementing these pilot projects, again, when we go back to the framework, the key challenge, as I had said, comes back to how do you do cost-effective evaluation, right? And so we really started understanding that evaluation is indeed critical to make CQI happen. And beyond that, if done nicely, it could help us in so many different ways. It could help us really create good, informed, data-driven collaborators in the community. It could help us articulate collective impact. Of course, helping continuous quality improvement, that's the goal, right? Result-based accountability, making informed decisions and resource adjustments, informed research-driven policy updates. So all these are no rocket science here. All of you who have been aware of the result-based accountability frameworks and evaluation frameworks, these are some of the key benefits we've been touting about for evaluation for the last 20, 30 years. But when you look at it from the context of continuous quality improvement and parent engagement, the key challenges that come out are that parent engagement has not been successfully integrated in the evaluation. Going back, 90% of indicators of the programs, one way or the other, have parent engagement as some of their quality indicators in QRS and beyond. But how are we measuring the parent engagement? Do we have good tools and assessments to do that? Yes, we have it in Strengthening Families framework, but is it like, how are we using it or not? The data that we do have that does become available, and we are collecting a lot of data, I'll talk more about it shortly, it's not available in real time to really support continuous quality improvement. And as I said, there's too much focus on compliance, and again, to repeat, traditional evaluation is costly and onerous to implement. So these are some fundamental changes. So how do we solve these challenges, and how do we solve these challenges? And when you look at data, let's forget the theory of evaluation. If you just look at the data, we have so much data, right? So in one way, we should be able to do everything that we looked in the slides before. Big smile, right? If we were in a big room, and I would say, how many of you are, how much of the resources among your staff is being used to collect data? I'm sure there would be a lot of frowns in terms of how much effort we're investing in terms of collecting data. So we should be smiling that we have so much data, but still we lack timely insights, right? So evaluation is critical for CQI. Evaluation is critical in general to make informed decisions. If applied properly, it can really help us in continuous quality improvement. We all are aware of result-based accountability and outcomes. We have so much data, but we do not have timely insights. So how do you solve this problem? And that's where some of the key breakthroughs in our approach come into picture. So in order to do this, we got together with some of the biggest thinkers in evaluation and behavioral research, and of course policy and folks like CSSP and ourselves, and everything that we learned through the listening tour, and what we believe we found the key nugget of insight to find this breakthrough was in a lot of business theory that is being applied these days in all the Silicon Valley and all the tech companies that are going on. And so the solution that we really found was in a concept called the minimum viable product. For those of you who are not aware of this, please Google this term when you get a chance, minimum viable product. And what the theory says is, and if you look at it in terms of data, somebody thinks that we need data, so we collect a whole lot of data. The market needs something else, and in this case, the market is our purpose to do continuous quality improvement. However, we can only afford this much of data, or we are forced to collect this much of data because we have to report to the feds, or we have to report to our funders and such. So how about if we can somehow magically find out what is the minimum viable data set that we need to start generating insights? How cool will that be? How nice will that be? All right. But if you collect just a small set of data, how do you do cross-sector and cross-strategy CQI? That truly is the goal, and that truly is the need of the hour. So then we can apply another theory that has really gained ground in last decade or so. It's almost like it's upending how businesses are run in general, and that's called the lean principles. And what the lean principles say is basically that before you start to measure something big, take that minimum viable approach, have an idea. So in this case, our idea would be that, sorry, I lost my mouse pointer. So it's basically an iterative cycle. And what you do in the cycle is you have an idea, and then let's say that we want to support parent engagement through continuous quality improvement. And then you build the minimum viable data set based on hopefully the most easily available data that you already have. We use that data to measure whatever CQI metric or indicator that we are trying to measure. We learn from it, and we see, hey, is this minimum viable data set enough? If not, then maybe we come back with another idea, make some assumptions, and repeat this process. And this is a key fundamental shift in how we have looked at things. So I'll pause here for a minute. Because historically, we have said, I want to do an evaluation. I want to run a QRIS matrix. I want to do CQI. So we will think the wealth of information and assessments and screeners and demographic data that we will need. And then we will say, all right, we will draw a logic model. We will identify indicators and outcomes, and then we'll collect all of this data. And somewhere down 1, 2, 3, 4 years down the line, maybe we will have this whole data set and we'll have a big evaluation report. But how nice it will be if we can take these lean principles, start with the data that we already have, all right? And so that's where our approach, the implementation approach, comes into picture. And as I'll tell you, the 3 pilot projects, and we've already implemented it to great success, is basically the approach of doing that, applying lean principles in our field is, let's start with auditing the logic model or a strategic plan. Let's start with a very basic audit of a data inventory, all the data that we already have. Identify the minimum viable data set that we need. If you have it already, that's great. If you don't, let's find out the most simple evidence-based and research-based as tools and screeners we can find. It very well might be a program self-assessment or a shortened version of that from Strengthening Families framework. It might be school readiness assessment, and that's why we have in our collaborative all these great research organizations involved, and then generate the basic insights and act on them, right? So let's do this in simple, small iterations, and if it works out, repeat. If it doesn't work out, let's try some other minimum viable data set. And as I said, we have been trying this on the field for 2 years now, and the results of these pilot projects have been phenomenal. So let me quickly talk about these 3 projects. So let's start with our Region 2 collaborative. In California, it's 9-county consortium, and this is where we started the most ambitious of this work actually. We started work 1.5 years ago, and we went with the assumption that everybody would know and would be implementing Strengthening Families. And very early on, rather than just creating a big data system and a big training curriculum, we very early on realized that each of those counties was at a very different place in terms of implementation of Strengthening Families framework. So the first thing that we did was we created some very user-friendly dashboards such that at the regional level, we could find out where every county is in terms of the readiness and preparedness for Strengthening Families. Out of that, we did several quick iterations in the last 18 months. So when we did this, what we found out was, as we had learned before, that we need to basically be, the needs out there are, in addition to continuous quality improvement, there is also strong need for evaluation, and there's also need for sustaining the funding because this grant is going to end soon. So from that perspective, then we are getting further deep into it, and we are looking everything more in terms of a 360-degree view of family engagement and CQI. So again, as you can look at it, we are getting further into dashboards and very simple. So as you can see from a previous dashboard to this one, we are simplifying things. So again, going back to this lean principle, minimum viable approach, we are simplifying this further. And then we have been building a very rich set of resources such that these counties who are truly, their parent engagement is part of their QRIS, and trainers, great training, the trainings that have happened, but they have an ongoing set of resources that they could be using at the frontline staff, the program administrators, and the county regional level to be able to do their job. All right, so it was a very short summary of this big, great project we have been doing. And on that note, actually, I want to quickly tell you, we will be doing some follow-up webinars where we will delve deeper into how each of these projects have come about, what were the lessons learned, how we went about doing, collecting data, engaging stakeholders, and hope you can join those webinars where we can delve deeper into it and hopefully find some value and some resonance with what you do in your programs. So next, very different end goal and pilot project we have been doing, as I said, in LA 211 and the Harbor Regional Center, and they have a very interesting approach from continuous quality improvement perspective. They have developed a new model, an amazing model and a framework for delivering their services. I'll not get into the details now. Again, please do join our webinar when we talk more about this project. But they really, over here in this particular project, they really are looking at the results and trying to apply it in real time to improve quality of the programs. And I'll show you quickly a few of the examples of how they are doing it. So the data was collected very seamlessly, just a very bare minimum program self-assessment data. And through that, in this case, what you see is across various indicators from program self-assessment, it's very easy to identify what is the most highest need of support. In this case, it's concrete support to promote and to improve quality of the program. So here we are delving deeper into the subscales of data that was already collected, and so the minimum viable data set was a very simple Excel sheet based on program self-assessment data that was already collected, and lo and behold, with a very simple analysis, we could find out exactly the hot spots where LA 211 and their partners could get high return on investment in continuous quality improvement. Another example is looking at pre and post. So again, sticking to minimum viable data set, they did collect data twice. That was great. And so they could use these results right away. Orange is the pre-test, green is the post-test. They could use these results right away. And we have our partners from LA 211 also on this call. And they're using it for various purposes. Of course, as you saw on the previous slide, they're using it for continuous quality improvement, but they're also using results like this for applying for more funding and really competing as a program with the big research institutions and such on implementing great models and frameworks for the services that they deliver. And then finally, looking at more at the further looking into it in the indicator level, you can further drill down and identify indicators that you might want to improve on. I'll skip the next graph. I am quickly doing a time check. Then they're also doing a lot of correlation of education level, which we know is a key indicator, is a big indicator in affecting the quality of the services and the reception of it by the beneficiaries. So again, with the minimum viable data set, they can really get deep insight. And in this case, we work with them and we partner with them to just not analyze the data, but also to see how we could be using these insights. All right. So let's quickly now jump on to another amazing project we've been involved into, applying the same principles in Louisiana Head Start. Head Start programs have always struggled to tell their own story their own way. They always are very eager to do the quality improvement in their programs, but have always lacked data to do so. And they have a lot of data to do so as well, but they've always lacked evaluation resources. So in this case, last year in Louisiana, with a very small, very less efforts and resources invested from the ground by the programs, we could collect really high quality data, and we could start making statements like Head Start works. So again, we used evidence-based results to collect information and say, hey, Head Start children are ready and prepared for kindergarten. Then we could delve deeper and say Head Start students are academically prepared to be successful in kindergarten and beyond, and also socially and emotionally they are prepared. Then we could delve deeper, now looking at continuous quality improvement perspective, where should they be investing the resources or not. We could do this correlations across parent education level. We could do this correlations across race and ethnicity of the child and such. And beyond that, from the advocacy purposes, we could also help Head Start programs in the state of Louisiana really compare that how Head Start programs are doing so much better than several other programs and preschool programs in the state. And I believe we have some of our Louisiana partners here as well on the call, so thank you for joining us, and we're proud to show the results that you have here. And as a next step, now we are taking in this school year, we are collecting the next year's data across the state again, and we are really taking the continuous quality improvement down to the front lines. And by that, what we mean is actually we're talking to the teachers and parent communities and such. So with all those success stories out there, the next steps are we are invested, CSSP is invested, Mosaic is invested, University of California, Western Michigan. So we have created this great evaluation cooperative, if you will. We have some funds that we have clobbered together to create this great initiative, and we are hoping that you could also join us in this great endeavor. You know, please do participate in the learning community. You can assist us in finding funding, or if you have dollars in your budget and you're interested in this, maybe hire this team to do work for you. Support us in outreach and growing this concept because we truly believe it can help us go on the other side of implementing continuous quality improvement on a day-to-day basis. And we are excited to announce launch of a new website for this purpose. We are calling it CQIHub.com. So please do visit this website. There's a simple registration form. Please register. And we might also reach out to you, all attendees who are here, to remind you about this. So please do join us. We invite you to help us, to support us, and to talk more about it. We all really know that we need to move continuous quality improvement forward, and let's do it. Let's get it done. I have a lot more slides on how this could be done and what your joining means, but we're out of time, so I'll pause here for a minute. And Kaylin, are you seeing any questions?
I don't see any questions typed in so far. People are welcome to type in a question or raise your hand and we can unmute you like we did for Rajel earlier. And that's within your, one of the little buttons on the side of your webinar panel is a hand that you can raise. Otherwise you can type in. And like Prashant said, there will be some follow-up outreach about joining some separate webinars to learn more about this. And I hope that many of you are interested and want to figure out how to be part of this learning and doing together. I see one comment came in from someone who typed in the CQI Hub web address and it didn't come up. Is that live yet?
It is live. Internet is taking longer than usual to propagate this. And so depending on the region, it should be, we are seeing it live in California. By hopefully tonight, everyone should be starting to see this live.
Okay, this is up to the minute stuff. And the other question that's been typed in right now is from Maria Doyle in New Hampshire asking, the presentation seems to focus mostly on ECE and QRIS systems. Would the CQI Hub be a resource to family support programs and others implementing strengthening families as well?
That's a great question because it helps me clarify that's absolutely not the intention. No, actually we are trying to break free from the QRIS mold. I just mentioned QRIS because we had early on heard a lot about it. No, thank you for asking that. That's the family support network type of organizations are the ones we really want to support through this. So no, it is for everything and hopefully way beyond QRIS.
Wonderful. We did hear from one other person, so now we've heard from both Massachusetts and Wisconsin folks having a hard time opening that, but try again tomorrow. Hopefully it'll be there. And we did get another question typed in. This is from Christina Soriano asking, is the portal free to join? How about the tools to create PFS graphs? Are those available for those who are part of the hub?
It is free to join. And once you, please do register and join a learning community. We are trying to figure out how do we sustain this. For the last 10 years, we have been doing this, and as you can see now the collaboration has grown a lot. Our intention is to somehow keep it low cost, free. So we're still trying to figure out how we sustain this. So that's the intention. Please reach out to us and let's brainstorm on what are the ways to do this.
Excellent. Thank you, Prashant. And I appreciate all that Mosaic has put into this over the years, and especially in this recent burst of activity with all the interest that's been coming up, how flexible you have been in finding solutions that work for the folks who are interested in working on this together. And I know we're at the end of our time, so I just want to thank you so much, Prashant, for presenting. And thanks for everyone who participated, and especially to Rajel and Nadia who spoke at the beginning about the conference. And hope to see you all soon, and hope you'll continue to join our webinars and stay tuned for more information about CQI Hub. So thanks everybody, and have a great rest of your day.
All right, thank you everyone. And this is what the website looks like, by the way, for those who cannot see. I'll just leave it open.
Okay, and hopefully that'll be available online soon for folks who want to look it up.